Hi, everyone. Welcome to Move More, Worry Less. I'm your host, Paige Vesta, the owner and designer at 13 Fit Apparel. I am so excited today. I have my friend Jocelyn. Oh my God. Why does it feel weird saying it? Jocelyn Lewiskin on here. She is a psychotherapist and a social worker. We met years ago when I taught indoor cycling. She would take my classes, I think on like Thursday, Thursday mornings at 9:30, if I remember correctly. And yeah, so I have her on here today. We're going to talk about all kinds of things mental health. So I'm really excited. So Jocelyn, if you want to give a little intro, tell us about who you are, where you're from, what you do, just a little background.
Sure. You sort of said it, most of it. I'm a psychotherapist, so social worker. I'm currently working in Brooklyn and Manhattan. I have a private practice where I see adults. Prior to that, I worked in an outpatient substance abuse program for many years, doing group work and interdisciplinary work with an HIV team. Mike, what else have I done? I've also done some teaching. I was teaching clinical courses at Hunter School of Social Work and the master's program there while I was working on getting my PhD, which I just completed in 2018. So lots of different sort of dimensions to my career, but most passionate about the clinical work and seeing patients and doing the one-on-one and the group work.
Yeah. I'm just going to jump kind of right into it. So you mentioned that you worked at an outpatient substance abuse program in East Harlem, correct? So I would love to hear more about that and like what kind of substance abuse, how you worked with the people there, and just kind of your experience there, I guess.
Yeah, sure. So I started working there in 2004. So the world of addiction looked very different in 2004 than it does now. It sort of changed over time, but I was there for almost 10 years. And what we would see mostly were like the sort of very typical addiction issues: marijuana, alcohol, heroin, crack cocaine, painkillers. Towards the later years, way more painkillers. That became very popular, and way more opiates. Obviously now that's now the big thing. But it was really interesting. It was such a such a learning lesson in the power really of mental health and people's decision making and people's sort of drive and motivation and how to make behavioral change and how to ultimately love yourself and take care of yourself. It really was like such a vast landscape to sort of play in with people and everyone's different like presentations on how they were addicted and what they were addicted to and what their addiction looks like and what their recovery looks like too, and how to help people get to a place of wanting to make change for themselves, not just because they're told to. A lot of my patients were mandated, so they were told to get sober, and that's very challenging. And a lot of them were not, and were understanding that self-destructive behavior was not going to take them to a good place and that they needed to make some changes. And I think what I learned there first and foremost was that there's such a split, and I think this transcends even into my private practice. There's such a split between people saying they rationally understand what they need to do for themselves, and then their ability and their motivation and their real execution of that change.
And why do you think that is? Or I guess maybe you know exactly why that is, but why is it that people can say they want something and have such a hard time acting on that?
So in the world of addiction, there's a lot of reasons why that's particularly hard. First and foremost, we always look at the physical addiction. Some people are physically addicted to the drug. So it's actually they're in pain if they're not using their substance. And those are sort of in some ways easier to treat because you treat the physical and then actually it becomes much easier. The harder patients are the ones with their psychological resistance, particularly around weed smokers who are just so in denial that you can even be addicted, or other things like alcohol. It's legal, so I don't have a problem. Well, that's not necessarily true. You're depressed and whatever other consequences are coming. So I think the resistance to change, I think that's just a consistent theme in human behavior across the board, addiction or no addiction.
Right.
It's what are the barriers to like essentially self-love?
Right.
So many, right? Trauma, um, childhood, childhood stuff like trauma in childhood, neglect, abuse, just sort of even family narratives about self-worth, self-esteem. Um, and then even beyond that, like the simple world we live in about like pleasure seeking, like doing things for ourselves is hard. It's
Right.
not easy. Like being addicted, seeking pleasure and like getting high or whatever it is that you're doing, tends to be easier in some ways for the
Right.
brain.
Right. So I guess my next question would be, what are kind of the most common reasons that people, like, how do people get addicted? Like, is it typically because of like mental health that they're reaching for something that makes them feel better? Like what I guess is like the most common reason for somebody falling into that?
That's such a great question because I think that a lot of people don't know the answer to that question. And therefore, there's a lot of judgment around addiction in our society. But honestly, I think if you choose to use a substance, you're placing yourself at risk for addiction. And
Right.
so much of whether or not you become addicted or not is so much about your baseline mental health. I
Yeah.
really believe there's people out there that are way more vulnerable to addiction than others. You go walk into a room and 10 people are using cocaine. How many of them get addicted?
Right.
I don't know. What's their predisposition? What are their vulnerabilities? What's their mental health look like? Does someone have depression? Does someone have anxiety? Does someone have, right? It's all brain chemistry. So some people's brain chemistries are pretty resistant and some people's are really vulnerable. And of course, trauma and the lived experience of ongoing drug use also complicates things.
Right.
And then there's actually the chemical and physical effect of the drug, which then actually leads to addiction.
Right.
So it's really hard. There's not one answer, but I think
Yeah.
so much of it is about like, it's a gamble.
Right. Is addiction more about mental health, or do you think that genetics play a role, or like how, because a lot of people say like, oh, well, there's a lot of alcoholics in my family, so that
Mhm,
makes me more likely. So I guess
mhm.
what's kind of the breakdown on that?
So that again is an interesting question. So genetics is mental health, right? Like we think about, and that I think is a question a lot of my patients that ask me still, even in private practice, what is mental health? Like
Right.
it's again, that's one of those words we use all the time. People don't even really understand what they're talking about.
Right.
Are we talking about my processing? Are we talking about my emotional health? Are we talking about my psychiatric health? Are we talking about, like, what are we actually talking about? And so when you think about it's really the brain. And so, yeah, if alcoholism runs in your family, there's a lot of evidence that says that that can be passed on. Not that you're necessarily going to be an alcoholic, but that you might have predispositions to that. The same way if someone in your family had high blood pressure or depression or diabetes, or I don't know if diabetes is one of them, but one of the things that gets passed on
Right.
through genes.
Right.
So it's both. I've seen plenty of people who have history of family addictions and they do not have addiction themselves. And I've
Right.
seen plenty of people who have histories of family addiction and they definitely have very similar addictions.
So then do you think that, because you're saying that mental health can be genetic, right? So do you think that these addictions are coming from like the mental health that might be passed through genetics? Like, I don't know if I'm asking my question kind of
No,
correctly,
it's
but do you know what I
possible.
mean?
Yeah, I mean, it's all possible. I think
Yeah.
that um, this sort of takes us to the nature nurture debate. Are you familiar with
Yeah.
this debate?
Yeah.
So it's the same thing. It's like, is this just your like nature? Are you born this way, or does this happen in your nurture experience?
Right.
And I would say for a lot of people who are more vulnerable to addiction, it's something in the nurture experience, usually a trauma, that sort of exposes that vulnerability.
Yeah.
Um, there's plenty of people walking around who might have a predisposition to addiction, but have never like tapped into that. So they just never became addicted,
Right. Right.
or they haven't had a trauma that maybe like exposed that vulnerability or anything like that. Or maybe they just never like used drugs.
Right.
And so they
Right.
never became addicted.
Right.
And maybe they're addicted to other things, kind of see it in other things. So
Right.
it is interesting. It's all, I think it's part of, I think mental health is the way I sort of describe it to my patients when we talk about mental health. It's like there's different components to your mental health. Obviously, one of the biggest ones is the way that you feel. But
Mhm.
another part of that is like the way that you behave feeds the way that you feel, and round we go.
Right.
and brain sort of controls all of that.
Yeah. I love that you point out that we just kind of use the phrase like mental health, like it's a very widely used term. And I've got to say, I use it all the time.
Mhm.
And I like that you are kind of breaking it down. I don't know if you have anything more to say about that specifically on like what mental health really means as a whole, because I think that it's just very common for us to be like, oh, well, your mental health matters, but like, what does that mean? And so you're saying you have like your emotional part of it. And I'm sorry, what were the other pieces
I
to
mean, I think
that?
the sort of bigger picture of it is your emotional well-being, right? It's sort
Okay.
of synonymous with mental health, I would say. But
Yeah.
so much of that then is like related to like the way you behave and the way you take care of yourself and what you do and your activity level and the way that you then physically feel. That's related too. I mean, some
Right.
people, when they suffer from depression, they have like physical symptoms,
Right.
and so it's all kind of related. But um, it is interesting. People do say the word mental health constantly all the time. They don't even really know what they're talking about. I mean, I just was having this conversation with a patient who was struggling with some mental health issues, some depression issues, and was going to talk and needed a mental health day from work. And was
Mhm.
like, I would like to tell my boss I would like to take a mental health day. And I was like, this is wonderful. Let's bring mental health to the world. Like, let's talk about mental health. And he was like, but I don't know how to describe what I'm talking about. And I was like, that's fair. Like, let's talk about that. Like, what are you trying to say? It's just like you need a mental health day. What does that mean? Like
Right.
people just we don't even really know what we're talking about when we
Right.
say that word. And he like understood, like he felt something, but he
Yeah.
wasn't quite sure how to like really explain that. And I think that's part of the I think it's a useful tool in therapy to like really talk about what are we talking about? Do you want to say to someone, I have depression? That's fine. Do you want to say to someone, I'm struggling with these cluster of symptoms? Do you want to talk about mental health in a way that's like very meaningful to you that at least you know what you're talking about? I don't know. Like
Right.
it's just interesting the language we use to
Yeah.
describe the way that we feel and what we
Right.
need.
Yeah. And that kind of leads me to my first question that I skipped and went. So we're all kind of scrambled here, but I think it works out perfect because I kind of want to define certain things because like you said, we use these terms and very casually and like people are throwing things out that maybe they're not even appropriate in the situation. So I just think that it might be nice to kind of lay things out. And the first question that I did want to ask you was the difference between like a psychotherapist, a
Mhm,
psychologist, a
mhm,
psychiatrist, then you have a
mhm,
therapist, you have a counselor.
mhm, mhm.
I feel like there's all these terms. Maybe some of them mean the same thing, maybe they don't, but I don't think that there's all that much clarity, at least from my perspective, because like I see a therapist, but I don't even know what that means exactly. So I think it would be really great if you could maybe
That's such a
run
great
through.
question. I can't
Yeah.
even tell you how many patients I have who literally don't even know what I am also.
Right.
Like, they just and it's amazing too, because when you show up to see a therapist, it's the amount of assumed trust into that professional is
Right.
incredible, right? You just show up, you're like, "That's a therapist," but, like, what are they?
Right. Right.
Um so interesting. Um, I'm a LCSW, a licensed clinical social worker, and I have been that since 2004. And that is where under that license, I get to do my clinical practice. But I also, in later years, have gotten a PhD. My PhD actually is not related to my clinical practice. My PhD for me as a social worker is totally academic. But a
Okay.
PhD for a psychologist means they're a therapist. So it's super confusing in that way. So
Okay.
um, there are psychologists who are PhDs in psychology. There are social workers who are masters of social work. There are licensed like marriage and family therapists, mental health counselors, sort of all the same. A master's level clinician is sort of all the same. And then a
Okay.
PhD psychologist is a psychologist. And
Okay.
totally in a different camp is a psychiatrist. They went
Right.
to medical school, they've studied psychiatric health and medicine, and they prescribe medication. On the rare occasion, you can find a psychiatrist who will offer you therapy. Very
Okay.
expensive,
Right.
but you can find one. Um, but most often, if you're seeking a therapist, you will see the language of like psychotherapist or potentially counselor. That's sort of synonymous with therapist. And typically, they're a licensed master's level clinician
Okay, got you. So
or
you are
or a PhD in psychology.
okay. So you're a psychotherapist, which means that your master's level. And
social
then
work.
your PhD is with like social work.
My PhD was in academic research, actually. I did my
Okay.
PhD like 15 years into clinical practice because I was interested in teaching and I was interested in some policy stuff and I was interested in a little more like just sort of to do something different.
Yeah.
And it sort of took me on a little bit of an academic track that I'm
Okay.
still working on. But
Yeah.
yeah,
Wow.
it's not related to, I mean, it is all related, but I couldn't just practice with my PhD. I need my master's.
Okay. Gotcha. So that kind of leads me into wanting to kind of explain some of the other language. And I know that in our pre-interview questions, we
Mhm.
talked a little bit about this, but words like trauma, anxiety, depression, you mentioned that people use these like so often, and sometimes they're not even actually accurate. So if
Yeah.
maybe you could break down what trauma really means, what depression really means, what anxiety really means.
Sure. Let's start with the sort of, I don't know which is easier, but like depression and anxiety, those are probably the most common words that I would say patients bring to me.
Yeah.
Trauma, they usually don't bring to me. Usually I'm bringing that to them in that way. Usually I'm the one saying trauma. But depression and anxiety, most people are coming in and it's like, oh, hey, why are you here? Oh, I'm depressed. Okay. That means nothing to me. I have no idea what you're even saying. And I'm sure you feel similarly if you speak to a friend on the phone, say, oh, I'm depressed. Like that can mean so many things. Like you
Right.
have to say more about that. Um, and same thing with anxiety, and the same thing, being a New York City based clinician, everyone is stressed.
Right.
I'm so stressed. I also don't know what that means. Like, what is that? And so when people start to really unpack those words, you start to really learn about what are the symptoms. And words like depression and anxiety are really just labels that help categorize a cluster of symptoms that usually just dictate treatment. It's like,
Okay.
it sort of helps you to know as the professional how to guide the therapy or how to guide the treatment, or for psychiatrists, how to medicate the symptom, which is why diagnoses are so important. But oftentimes, what's so fascinating about depression and anxiety is that they can sometimes look exactly the same. You can
Right.
have symptoms of anxiety and present as depressed because your symptoms of anxiety are so exhausting and so tired, that make you feel tired and hopeless and sad. And so you can seem depressed, but the real root is anxiety. And the flip side could be true too. You can actually feel depressed and have depression, but your symptoms are anxiety. Like, oh no, I'm so sad, but I have to go to work. So now I feel anxious, or I have to go to this party and I don't want to. So I feel anxious. And you could talk about anxiety till you're blue in the face, but the core issue is depression, is sadness, hopelessness, despair. So it's interesting how they flip flop. I once had a psychiatrist tell me, which I thought, I always remember this. He's like, Jocelyn, you should always think of depression and anxiety as first cousins. And I thought that was so great. He's like, they're always right next to each other. And you have to
Right.
understand which one comes first. So they're different, right? Depression
Yes.
presents as, oh, sorry, do you have a question?
Yeah, no, like you're blowing my mind right now. So I'm just like, now I have like 100,000 more questions that I wasn't even planning on. But so then how do you know? I guess in two ways. How do you know as a professional what's really going on? And if you're just like a person like me, like I've basically self-diagnosed myself with like depression and anxiety. And like, sure, I've had people tell me the same thing, but like how does somebody kind of know what they're going through, and or do they need a professional to really unpack what's going on? And at you on the professional side, how do you know what's going on, and how do you know whether it's
Yeah.
depression or anxiety?
So I would argue you need a professional to help you because it's very hard
Okay.
to have a one-sided conversation, right?
Right.
It's very hard to unpack this by yourself. And oftentimes we can convince ourselves that we have something, right? And
Right.
that's not to say you don't have depression and anxiety, but I would argue to someone, if you were my patient, I would ask you, do you feel depressed and feel anxious, or do you have depression and have anxiety?
Right.
Those are different things.
Right.
Right? And most people are like, oh no, I just feel depressed and feel anxious. And they're like, but wait, what's the difference? Okay, well, the difference is if you have depression, that is a chronic debilitating disease. And
Right.
then there's a cluster of symptoms. We can like open up the diagnostic manual and like read through them. And do you meet the criteria? And do you have any like these symptoms? There's a cluster of symptoms. Um, you know, like there's so many of them. Most commonly, it's things like negative thinking and low mood and despair and hopelessness and any kind of like suicidality, right? Like that's sort of extremely depressed. And the same thing with anxiety, irrational fears, compulsive behaviors, whatever those clusters of symptoms are. And once people start to really look at what the diagnoses mean, They're like, "Oh no, I don't have that. I just like don't like being around people." I'm like, "Well, that's not necessarily anxiety. It's not necessarily fitting the definition of social anxiety. That means you're anxious, and that's okay. That's not great. We can work on that. I'm sorry
Right.
you feel anxious, but it doesn't mean that you have anxiety,
Right.
right?" And so it cuts both ways to sort of help people realize that maybe they don't have the diagnosis they're throwing around all the time could be useful. And sometimes it really helps people to see that actually they do have the diagnosis. It's like,
Right.
oh, wow, I really do have depression. Or, oh, wow, I really do fit the criteria for someone with, generalized anxiety disorder. Like, that's interesting.
Right.
Now what? It's like, oh, okay, well, now that we understand, now we can like figure this out together.
Right. So then if somebody came into you and they're like, I have anxiety or I'm feeling anxiety, and you wanted to diagnose them, for you to figure out if it were anxiety or depression, are you kind of just like listening to their symptoms and then kind of matching it? Like, can they have both, or are you
Of
matching their
course, they
symptoms
can
to
have
one
both.
or the
They're first
other?
cousins. They're very close together.
Right.
They're very close together. So that's the hard part about being a therapist is
Yeah.
the first session for me is like, the sort of intake session where you're gathering really all the information, you're getting the background, you're getting all the sort of the client's narrative about, how they're feeling, what they present, and a little bit of history. That's sort of the easy part. It's the second and the third and the fourth and the fifth session that are usually pretty challenging when you're really trying to like parse out the things. You're like, what is this? And for me, with the background in addiction, my first thought is always like, this could also just be addiction, right? Like,
Right.
addiction also presents as depression and anxiety and mood volatility and all these things. So it's like, I'm always thinking that first. And I was, okay, so if we rule out addiction and this is just what someone's mental health looks like sober, then what are we working with here? And
Right.
it takes time. And I think people assume they're going to go see a therapist and they're going to walk away with a clear diagnosis. And sadly, they are going to walk away with a clear diagnosis because we need that for insurance purposes.
Right.
So usually at the end of a session, you have to come up with some preliminary concept of what someone's going through so you can bill it to the insurance company if you're billing
Right.
to the insurance company. But for me, that often changes.
Yeah.
I'll like meet someone and we'll do like a preliminary diagnosis. Okay, well, I'm thinking you have like, generalized anxiety disorder. And then like, 2 months later, I'm like, actually, you have depression because you've had some serious trauma that you
Right.
haven't dealt with. And this is not generalized anxiety disorder. You have anxiety symptoms,
Right.
but this is something else.
This is so interesting, and it's getting more interesting than I even was anticipating.
Mhm.
So I was talking to my brother the other day, and we were just talking about like anxiety and all of that kind of stuff. And he was saying, and I hope he doesn't care. I mean, whatever, he's fine. Because he was just trying to like understand. He's like, how do you know if you have a normal amount of anxiety or is
Yes.
it a problem?
Mhm.
So I guess that's my
Exactly.
next question for you. Like, how do you really, or is that just based on person to person, what they can handle or how they're able to cope? You know what I mean?
I honestly, it's all those things.
Yeah.
So for me, the barometer is level of functioning, right? So everyone comes in, they have a certain level of functioning that they expect for themselves. And some people's expectations are too high and some people's expectations are too low. So interesting barometers,
Yeah.
but generally speaking, we all have some level of expectation on the way we should live. Wake up, do something in the day, eat, shower, maybe talk to someone, eat again and go to sleep. I mean, it's pretty basic. Pay your
Right.
bills, maybe clean up, maybe don't. I don't know. But there's some like baseline level. And when people find that they can't function the way that they used to, and I always encourage people, compare yourself to yourself. What were you like 6 months ago? What were you like a year ago? What's your functioning like? Um, that's sort of how I measure it. And a lot of that is based on off people's tolerances. Like people can't tolerate feeling anxious. And so that for them, that's a problem. Other people have very high tolerance for anxiety and can really push through some real discomfort and be extremely successful with that. Other people can't. So they both could have anxiety.
Right. That's super interesting. I love that answer. That I'm gonna have to call my brother later, or maybe he'll listen to this podcast. Who knows?
But it is, it's always fascinating to me when people can say like, oh yeah, I used to like wake up happy. I used to wake up with energy and now I can't get out of bed. Like that's something, like that's a measurement of
Right.
comparison. Or I used to like thrive with the energy of a lot of work and now I just feel like suffocated by it. Like
Right.
things like that are really indicative of how someone's doing. And like that's
Right.
sort of what we're asking in therapy is like, how are you doing? How are you feeling? How are you living? Like, are
Right.
you thriving? Are you surviving? Are you drowning? This sort of like moving away from stressed, depressed, and anxious, and
Right.
trying to get to like a little bit more like other characteristics of your life.
Right.
That takes work to get people to like really talk about it.
Yeah. I can't even imagine what you do is very special. um, so then I guess in a normal person's life, I would assume, and I could be wrong, your level of stress or anxiety or depression can ebb and flow and go up and down.
Mhm.
So what is a pretty, like, how do you know if your cycle or your ups and downs are kind of normal, or is it again just based on tolerance or how you're able to cope?
Well, I think that's one of the interesting things about really engaging in therapy is you can really learn about yourself in that way. And, some people get so upset when they're sad, but sometimes it's very appropriate to be sad, you
Right.
know? And sometimes people are so overwhelmed by the stress that they're experiencing and they think that's a problem. And I'm always encouraged, it's okay to be overwhelmed and stressed. Look at what's happening. I mean, I'm saying this constantly and I'm like, look at what's happening. We've been in a pandemic for like, 18 months and the world is this and like going outside used to be scary and your kids are home and you're like, yes, of course you feel these things. Like this
Right.
is normal. To think you're going to feel glorious during a time of high stress, you
Right.
know so it is interesting. I think so much of this is the cultural messages we get in our world today. It's like you're not supposed to suffer, and of course we're not supposed to suffer. We're supposed to love our lives and enjoy our lives and thrive and be our best selves. But there are times when your body is telling you it's upset and stressed and tired, that's okay. That doesn't mean it's a sign of like dysfunction. It actually is your body telling you, slow down, take a minute, this is a lot. Like maybe this is not safe, maybe this is not a good idea. Like those things sometimes can be true. It's not always pathological.
Right.
So I think sometimes we're really quick to be like, there's something wrong because I can't get up out of bed. I'm like, okay, well, what's your day look like? It's like the day is horrible. You know, you sort of shared about like feeling burnt out at a time. Like when
Yeah.
you know you're burnt out, that doesn't mean you're diagnosable. Like you don't need mental health treatment. You need to like take better care of yourself. I mean, that's
Right.
all could be part of mental health treatment, but it doesn't mean there's something wrong with you. It means something is wrong.
Right. I love that. I read a book and I can't remember which book it was now, but I just remember like she wrote in it, I think it was Untamed. And
Uh-huh.
just one
Oh,
line that really sticks out, it was just like, it's okay to feel your feelings. Like feelings are
yes,
meant to be felt. And
yes.
I love that so much. And it just goes along with what you're saying. Like you're not always going to be perfect. Like things do happen and it's okay. And I guess just understanding like when do you like noticing when you need help or
Mhm.
whatever the case is.
And it's interesting because when you think about people's symptom, even the language of symptoms, like someone can come in and be like, I'm not sleeping. I'm waking up in the middle of the night 3, 4 times. And it's like a huge presenting problem. And I'm like, oh, wow. Okay. This is really hard. And then like the next person comes in and they're like, oh yeah, I don't sleep, no big deal. So that could like one person thinks it's a huge problem. The other person's like, I don't even care. Like who cares? Is I just wake up and then I go back to sleep.
Right.
But like sometimes things bother people that don't bother other people. And
Right.
it's complicated because we don't know how to measure whether or not we're doing okay.
Right. Yeah, that's a really interesting point, just what certain people can tolerate and what doesn't bother them versus what does, because two different people can live the exact same life and experience it differently.
Yeah.
Um, that's really interesting.
Ultimately, it matters like what do you feel in your life and how do you think you're doing?
Right.
And then we
Um,
can talk about that. Let's unpack that. Let's figure it out. Maybe we can like rewrite the narrative. There are a lot of people who like really believe in their sort of path of not being well. It's like very hard for them to see where they're actually doing well.
right. I can honestly say I feel like I relate to that. I often put myself in a place where I'm like identifying with being like an anxious person or a depressed person when like right now things are a lot better than they used to be. And
Right.
so I guess that's something that I definitely need to work on, but just kind of being stuck. Like it's funny because it's like a joke sometimes, but like with like my friends or my family, we like joke about the fact that I'm like kind of a mess like 90% of the time. But like but at the same time, it's like something that, like you're saying, it's like a narrative that we've like written, and it's like, I'm working really hard to not be that way, but I've kind of put myself in a place where like, this is who I am.
That's so fascinating. And I find you are not alone in that experience. That is what we talk about when I think I mentioned this to you in like people's narratives. And
Yeah.
oftentimes I'll ask a patient, I will ask you, like, whose voice is that? Like this concept that you're a mess. Whose voice is that? Is that your voice? Are you telling
Right.
yourself you're a mess, or is everyone laughing? Is your whole family laughing at you that you're a mess? Is it there? Like who's labeled you that way? And
Right.
then it becomes a self-fulfilling thing. Every time you feel like you're a mess, you're like, oh well, I'm just a mess, and I give
Right.
up, and I don't know what else to do. And it's fascinating watching people not live their narratives. I mean, it blows my mind how incredible people are and how they cannot see that for themselves because they are
Yeah.
stuck in this like vision of like, but I'm a mess, or I'm a failure, or I'm a loser, or I'm unlovable. Unlovable is a huge one, but actually no, everyone's loving you, but like they can't feel it, or you
Right.
can't, or like if you're so successful but you can't connect to it because you've decided, and because it's been told to you so many times, it's so internalized that you're
Yeah.
just uh, like your self-worth is low.
Right.
So it's just so interesting to help people get away from some of these like repetitive things that the automatic thoughts of just
Yeah.
like, I'm bad, I'm no good, I'm gonna fail, I'm gonna mess up, I'm gonna, like, people just are really stuck in that.
Yeah. No, I've never even thought about it like that, which is just like my head is like spinning now. And it's to nobody's fault but my own, really, because I've always been like, oh, I'm an anxious mess, or like whatever, like, because I'm an overthinker and all these things. And so oftentimes, like, I'm on Instagram and like me and whoever are tagging each other in like funny posts about anxiety or like these things. And it's like, and I've labeled myself almost as that way. Um,
It's interesting.
which
We
now saying
create
it out loud, I'm like, that sucks of me. Like, why am I
Mhm.
doing that?
Why are you
Yeah.
doing that? Yeah.
I don't
And if I was
know.
your therapist, I would help you to see the other points of strength in your life, right? Like,
Yeah.
are you this thing or are you this other thing? Are
Right.
you this like successful entrepreneur? Are you this strong, confident podcast host? Are you, right? Like there's other parts of you. Um, and people get very uncomfortable with that. They get very uncomfortable breaking away from this internalized narrative that they have about themselves. And that's the best part of the work, is
Yeah.
watching people really like those aha moments of like, oh, okay, leaning in any direction, like, oh, okay, maybe I do have this mental health issue, or oh, maybe I don't, or maybe this is the question I get a lot is this my fault? Because we talk a lot, I talk a lot about like, challenging the narrative or taking responsibility for yourself, or sort of, motivation for change, or, sort of helping people to feel their own power around this stuff and not falling into a diagnosis. Even if you have a diagnosis, there's still places of power, there's still places of
Right.
strength.
Yeah.
I really try to help people to find that. Sometimes, it can feel a little bit like, is this why you telling me it's my fault? I'm like, definitely not telling you it's your fault, but there's things that you can do to make some small changes, just even thinking about things differently, like, or reframing something for yourself.
Right. Right. That's, I love that. That's so interesting. I want to continue on
Mhm.
defining things that are
Mhm.
not properly defined or used casually or whatever. So trauma was another
Mhm.
one. I know
Yeah,
that in our pre-interview questions, I mentioned trauma and you were like, this is kind of like a big one.
this is a huge one, of
Yeah. So
course.
I would love for you to dive into it, and what does that mean and how do you bring it up to your clients, and how, I don't know, just like the ins and outs of it.
I mean, that's like a billion-year conversation, but sort
Is
of
that
a
another
headline
episode?
on that is, sort of boiling it down. The way I think I talk about trauma with my patients most often, when a couple of things come to mind, even in this question. A lot of people are very resistant to the word trauma. It's a hard word to bring up. Unless someone comes to session and they're coming into treatment, they understand they've had a trauma, they can name it, they can sort of identify it as a trauma, like, things that we would all agree are traumatic events, like some sort of abuse, or of, witnessing, great violence, or, something like really, sort of what we all would agree, like, oh yeah, that's traumatic. That, those cases, that work is sometimes a little bit easier to approach. The hard part is when people have had what we call little T's, like little traumas, like more passive traumas, like things that other people might just let roll off their back, but this person is feeling really impacted by it, and
Mhm.
helping them to understand what a trauma is. So, um, something like a bad breakup could be a trauma. And people are like, oh, no, that's not a trauma. That's just like a bad breakup. Everyone has a bad breakup. And I usually work backwards. So, usually, when I see someone having a trauma reaction to things, is when I help them try to understand a trauma. And the way I describe a trauma to them to help them understand it easy or digest it in a way is trauma is when your sense of safety gets taken from you without your without being prepared. So when you think of it that way, it's like, oh, then lots of things are traumatic.
Right.
And that could be just a helpful framework to think about, like, oh yeah, I did feel unsafe. Like that's very powerful to feel unsafe, or to feel like you don't have an ability to protect yourself, or you feel like you're in harm's way, or your life just changed really drastically for the worse, or something's coming for you that's dangerous. I mean, these are all like pretty big feelings. Um, and people can usually grab onto that in that way. But, you know, when your safety is taken from you without any preparation, your brain has a reaction to that. Your brain remembers that, and your brain will forever try to prepare you to prevent from feeling that thing again. And that's the trauma response.
So, how do you know with your clients that their behavior or their response to something is coming from a trauma?
That's a great question, because you sort of just know, like you see it so often. It's such a clear characteristic of it's like a defense, or the way in which people cope with things. It's somewhere it falls. I guess the best way to describe it, you see patterns of fight or flight in
Mhm.
someone, where they freeze, or they run, or they sabotage, or there's just sort of like very specific things. You're like, wow, what are you responding to? Like you
Right.
can literally see someone's brain like activate and be like, uh-oh, and it's not the actual trauma recurring again, because whatever trauma happened is way gone. It's whatever is happening in life that like presents itself similar to a potential trauma again. So
Right.
like a great example of this is like relationships. A lot of people who've had emotional trauma early on in life have a hard time having intimacy. And so like, what are the ways in which people sabotage intimacy? And it's like, what are you responding to? Why are you running from this thing? Why are you scared of love? Or of course, we're all mildly scared of rejection, but why are you so scared of rejection? Like, what is that about? And sometimes it's helpful to recognize that someone has had a trauma in that department. And so, therefore, your adult version of your brain is so like flared up every time you feel vulnerable, because you're like, oh no, there's like parts of the brain literally that get activated when there's a potential trauma coming. I mean, we are smart people as humans. We know what's coming.
That's
And we
crazy.
think we
So,
know what's coming. That's what the brain is telling you. You think you know what's coming, then your
right.
brain and you respond in a way that's very like, you know, guarded, or running, or any of those kinds of in that sort of vein.
Right. So in like the example of a bad breakup, somebody might, I'm saying this because this is a kind of how I think that I can be, is like you don't want to feel that pain again. So the self-sabotage is like you're not in control of it really, right? It's like something in your brain is like, well, if I sabotage this, I'm not going to get hurt again, kind of a deal.
Mhm. And,
Right.
and for most people, that's not totally conscious.
Yeah.
Like, you're not really making that decision out loud. You're not like, oh, I'm gonna protect it's happening so fast in your body that you
Right.
don't even really know what's going on. Which is why, again, being in therapy, when you can like talk about these things. I mean, I've like,
Yeah.
catching people in the moment, like, oh, wait, before you do that thing, let's see where that's coming from. Like, what is that really about?
Right.
What are you responding to?
Yeah.
What's the response? So I think in that way, a lot of times I find myself working backwards and helping people to understand traumas. Um, and that's, I'm going to say a lot of fun, but it's hard work, because that word is so loaded.
Yeah.
The other thing that's so fascinating about trauma is very similar to addiction. Everyone responds differently to trauma. So there are people in the world who've experienced horrifying traumas, and they have like no symptoms. They're fine.
Right.
They no PTSD, no anxiety, no insomnia, no flashbacks, nothing. They just experience the thing and they've moved on. And then there's other people who experience things just as bad and are just can't get past it emotionally, and their brains can't get past that, and like 1,000 versions of in between. It's so
Right.
interesting.
So between addiction, trauma, anxiety, depression, it's all kind of like some people react a certain way, other people's don't react at all. So it really comes down to their tolerance or however you want to describe that. So my question is that a chemical thing? Like what determines what you can tolerate?
That's such a
I
great
guess.
question. I don't actually know the answer to that,
No.
right? There's tons of theories about it. There's theories about resiliency, there's
Mhm.
theories about um genetics, there's theories about nurturing, there's like
Right.
concepts of like, if you're well supported during the trauma, then you won't have the residual effects of the trauma. I don't know. Probably that's a little bit true, of course. Like I
Right.
like to believe in treatment and support and love and
Yeah.
care and all those things, but you really don't know.
Right.
There's also some people who present with, significant mental illness, right? So
Yeah.
what we've been talking about is like mental health, right? Which is sort of just
Okay.
the general emotional well-being of a person. And some of these diagnoses, obviously we're talking about depression and anxiety, those are under the umbrella of like a mental illness. But there are some people who have like pretty severe and persistent mental illness. And so they process things completely different.
Right.
So, and like who gets mental illness? Like why does one person get mental illness and one person doesn't?
Right.
So it's all sort of, we don't really know the answer to that.
Right. Oh my
I
gosh.
think
We're
it's
going to
just under
have
the same,
like to have
yeah,
like 5 other episodes about this stuff
I
because
think,
there's so much.
yeah, I sort of think of it as it's under the same category as health, right?
Yeah.
Ultimately, we're talking about our health and our well-being.
Yeah.
And so if you have something that is hard for you in your life that's causing a problem, like, I don't know that there's a reason why it's you and not the other person who's having that problem.
Right. Gotcha. Um, Another thing that we mentioned before was mood instability.
Mhm.
And I've talked to my therapist about that, but we didn't talk about it very much. So I would love to talk a little bit more about what that means. And I think the name might seem obvious, but like all these other terms, I think that it's really helpful to just define things. I'm
Mhm.
assuming it means, like your mood isn't stable.
Mhm.
But I'm sure that there's more to it, or I don't know if there's anything you could say about it that.
Sure. So there's a whole cluster of, mental health disorders that are around mood. Oh my God, what's the word? Mood. They're called mood disorders, right? And so they sort
Mhm.
of typically sort of define the way people's moods fluctuate. Um, Obviously, bipolar disorder being one of them.
Mhm.
Bipolar disorder is a very popular word. People think everyone thinks they're bipolar. Bipolar disorder is very specific. It's not just fluctuations in mood, right? There's bipolar disorder is characterized by depressive episodes that are significant and manic episodes that are significant. So like really high and really low, oftentimes cycling really quickly, sometimes cycling really far apart. But it's pretty clear when someone can present with bipolar disorder. When someone presents with a mood disorder, which again, a distant relative to depression and anxiety, or potentially a result of addiction, or stress, or life, or any of these things, or a mental illness. Um, what that's really just indicating is that there are mood fluctuations that are not really responding to anything external. So when like your external world is throwing stress at you or throwing bumps or giving you stuff to be upset about and you're upset and you're up and down in your mood, that that's not a mood disorder. A mood disorder is when for no reason you're feeling intense fluctuations in mood and you can't understand why and that feels out of your control.
Right. So
And so
then,
for some people that's chemical, for some people that's hormonal, for some people that's diet, for some people that's exercise, for some people it doesn't matter any of those things. They just are going to have a mood fluctuation.
right. Okay. That was going to be my question.
Yeah.
Um,
I would argue for that kind of experience, medication could be really helpful.
yeah. Yeah. So I guess at what point, as you don't prescribe medication,
Mhm.
correct? So at what point would you send somebody? I guess, I don't know, if you think somebody needs to be
Mhm.
medicated, would you send them to a psychiatrist? At what
Mhm.
point do you kind of notice, like, is it an immediate thing that you're like, oh shit, this person needs like more help, or is it over time you kind of feel them out? How do you
So
go
so
about
much
that?
so much of that, obviously, all these questions are somewhat case independent. So if
Of
someone
course.
comes to me and they're presenting with pretty significant symptoms of anything, and in their history they've done well with medication, I might suggest right away, like maybe you want to get back on your medication as a starting point because they might be better receptive to therapy if they're more stable.
Right.
If someone has no history of medication or medication intervention ever, I'm really not that quick to jump to medication unless someone is really psychiatrically unwell, like if they're having
Right.
delusions or hallucinations, or even something like panic attacks. That's just so uncomfortable. If you're
Yeah.
really feeling like your life is really being impaired and your functioning is really being held back by a symptom, and you don't have time to like really do the work of therapy, I would definitely recommend trying to get on medication to help stabilize.
Right.
But mostly I find it's a long conversation for people about the decision to get on medication. And
Yeah.
for me as a therapist, I'm always going to support someone's choice to want to try medication. I'm also always going to support the choice to not want to try medication.
Yeah.
Again, as long as the symptoms are like, mild to moderate and they're safe. If they're like, really struggling and they're having thoughts of self-harm or anything in that way, then maybe I would be more forceful about a higher level of care or more intervention. But a lot of times the journey of therapy can be very painful. And as you like navigate unpacking these things, there's ebbs and flows in mood. And sometimes, it's an awkward position as a therapist to be in because we want to help, we care, we want to like the whole goal is to feel better. But sometimes there's parts of therapy that cause mood instability, that
Right.
people get anxious coming to session, or they leave feeling sad, or they're like they've opened up a wound, or they've touched something that feels really vulnerable to them, and so that they're holding that for the week until they see me again. Or so sometimes, again, like we talked about earlier, it's okay to feel your feelings.
Right. Yeah. I love
That's,
that. And
that's a hard conversation, and again, it's kind of different for everybody.
yeah, I've definitely experienced that where, I mean, most of my therapy sessions, I feel like I leave feeling okay and like kind of accomplished, but I've definitely had those ones where it's just like emotional, and she says things that are hard to hear, but they're true
Mhm.
and necessary. And like you're saying, it's okay to feel your feelings and to get through them and to like figure things out and learn how to cope and deal with the situations in life. Like
Yeah,
it
that
seems pretty
that that
necessary.
thing about feeling our feelings is akin to like building a muscle.
Right.
It's like you have to practice feeling your feelings. Again, I go back to this, like, the world we live in, like, we are not taught to feel our feelings. We are taught to run from our feelings. We are taught
Right.
to self-medicate. We are taught to, zone out. We are taught to like not connect to ourselves. Our mind-body connection is so disconnected.
Right.
And to get into a place where you have to like sit with your feelings, a lot of people prefer not to do that.
Right.
So I meet with a lot of people who are like, I don't actually want to do this. I actually just want medication. I'm like, okay, well then go get medication. But I think you might long-term benefit from actually like doing some of the work, because it's skills you're building in therapy, really,
Right.
what it is.
Right.
Like distress tolerance, even that, like being uncomfortable in the room with someone, having an uncomfortable conversation.
Yeah.
That's skill building. It's
Right.
emotion. Learning how to emotionally regulate is so powerful.
Right. I'm going to wrap this up with this question.
Mhm.
For anybody who has reservations about seeking professional help with whatever it is that they might need help with, what would your advice be?
I absolutely would advise to shop around for therapists. I think finding a good match is so important. And sadly, having a bad match of a therapist is sometimes damaging and not not helpful for anyone. But if you find someone that you can connect with, and people are always like, well, how do I know? What questions do I ask? And sure, you can ask the questions about like training and background, education, all those things, but that's not really what you're looking for when you're looking for professional help. You're looking for a connection, like a vibe, kind of similar to dating,
Right.
like, do you feel comfortable talking to this person? Um, the takeaway should be, I felt comfortable talking to this person. I felt I could be myself. I don't feel embarrassed, or I don't feel, I feel like I could be open, or they asked me interesting questions. So I always suggest to people, try to go to see a therapist, try to find 4 therapists or 3 therapists or whatever, shop around, go to a couple sessions, feel it out. Um, and don't be discouraged if it doesn't feel good right away, because that's also part of this too. It doesn't always feel good. The
Right.
other piece of advice about therapy I try to give to people is reminding people that therapy is long term. It's similar to exercise. You don't exercise once and get in shape.
Right.
You have to do this repeatedly every week, maybe twice a week, for a long period of time to see results. But the results are so worth it. And I like to think different than exercise, that therapies, the results could really be like life-changing. Exercise could be life-changing too, but
exercise is definitely life-changing.
Life-changing, but therapy can be more permanently life-changing. Exercise, sometimes if you fall, you got to get back on the horse, you got to start over.
Right.
But yeah, I mean, I think it's scary to take that first step. And I think because people don't know what to ask and they don't know what they're looking for, it could be hard.
Yeah.
But I think the thing that you're really looking for is to just feel like there's someone who understands you and someone who you can talk to.
Right. I remember when I was living in New York, I tried to get a therapist and I had her for like 5 minutes. But like you're saying, we didn't vibe, but I didn't really know. You don't really, especially if nobody's ever told you, you don't really know what you're looking for or what to expect. And I felt like when I went to her, I left, or even talking to her, like I didn't feel comfortable talking to her. The reason I went to her in the first place, I didn't even bring it up in the first session because I didn't feel comfortable. I felt like she didn't, not that she wasn't listening to me, but she didn't seem to want to actively help me be active in my journey. It was like, I felt like she felt bad for me. Like she just pitied me because I was like pathetic. And not in like a condescending way. She was a very sweet woman. I'm sure there's plenty of people who vibe with her, but it just like, it wasn't what I was looking for. And then, and it's definitely hard to make that step to see it. Cause after that I was like, well, this sucks. I tried, and,
well, what's really interesting about the therapeutic relationship is like no other professional relationship. Right. My relationship with my patients are some of the most intimate relationships I have in my life, for me,
Right.
and for them, obviously, but also for me. So like you should feel cared for by your therapist as a baseline. You should feel like your therapist is interested in you and curious about your life story and curious about your experience and involved and engaged. At least that's what I would want. And that's what I offer my patients. And if they don't feel that from me, then we're just not the right fit.
Right.
It's also interesting to think about, I say it like so casually, like, oh, you should vibe with them. But that's not advice you give to any other profession. It's not like, oh, I have a great, doctor for you, like a primary care doctor, like you're going to really vibe with her. It's like, you don't care. You go to the doctor, you get the thing done, you have your checkup and you leave. But the therapy relationship is really a special one.
Yeah.
I mean, it's really intimate.
Right. For sure. I mean, this time around, I've had my therapist for a couple months now. And I mean, probably more than a couple months, but it was hard to get into. My sister kind of had to push me. She was like, Paige, come on, like it's time. And so I did, and I did it on betterhelp.com because I don't have insurance. And I feel like I got really lucky because I definitely vibe with my therapist. What I really like about my sessions with her is that she usually leaves me with homework or something to think about. She asks me a lot of questions and it feels like a conversation. I don't feel like I'm just sitting there venting to her. And I tell her about good things too. It's not just being like, like today, I had therapy today and I was telling her how like good my relationship is. And we didn't really talk about anything negative. But she asked about all kinds of different things. And I always feel leaving listened to and accomplished. And I do feel like she really cares. And so I guess my point is that I agree with you. Like it's a vibe.
Oh, great. And what's so fascinating about that is when I have those kinds of sessions with my patients, they're like, oh, we didn't even talk about anything bad today. Like, I just have good news. Like, I say to them, that's wonderful because these are the building blocks of our relationship. So in my brain, I'm like, inevitably, when you have another depressive swing, I will be able to bring, like, this is evidence to your success. This is evidence to your strength. Like, you're not always a mess, clearly, because today you showed up and you were not a mess, right? Like, this is part of your journey. So people also think, and I think this is a sort of myth of therapy, you have to be miserable to go to therapy. You have to have a problem to go to therapy. You don't. You just have to be curious about yourself to go to therapy. You have to want to engage in a relationship with someone who's also curious about you to help you be the most curious you are about yourself, to help you learn more about yourself, to be the best self you can be. And that could be up and down.
Right. I love what you just said, that you just need to be curious about yourself. That is going to be an Instagram quote for our social media. That is so awesome, because that's
true.
So perfectly said, because like on your, if we're going to talk about like 13 Fit Apparel's mission, like on your journey to your ultimate self, you have to be curious about yourself if you want to continue being better, because if you're blind to who you are and what's really going on, how are you ever going to improve? I love that. That's awesome.
It's sort of my, like, I think my framework on therapy at this point, because what I really try to do is help people pull away from the words like depressed, stressed, and anxious, because you're not curious when you say those words. You're just, maybe you're being accurate, but it feels just very easy. Those words are very accessible. I mean, I say them all the time. Oh, I'm tired, I'm depressed, I'm anxious. Like, I don't know. Like, I think there's more, you know? And people get excited it's when I'm asking, like, but what are you really feeling? Or what else are you feeling? Or what, tell me more. Like, if I'm curious, like, that's inspiring their own curiosity about their own journey and to like uncover what's in there.
Yeah.
I find that when people come to therapy, oftentimes that first session, what people bring, it's never what we're really working on 6 months later, a year later, 3 years later. I mean, I've been so lucky. I've had patients for so many years. I've seen people through such wonderful life transitions. It's not all bad. It's, of course there's struggle. We're humans and there's like stuff, but there's really, really, really good things to doing the work.
Yeah. Oh, I love, this is so awesome. Thank you so much for being on stage, Jocelyn. You are so awesome. And I'm so excited that all of our community gets to listen to the things you have to say. And we're definitely going to have to do a follow-up episode. Thank you everybody for listening in. If you haven't hit subscribe, you totally should. Thank you.